Hi, good afternoon, everybody. Yehudis Schamroth here again with another episode of Wellness Wednesdays, where I discuss all kinds of topics that are health and wellness related. I've been doing this for about 2 years, so you can check my Instagram page, which is new, RBS Acupuncture, YS. You can check my YouTube channel, which is Yehudis Schamroth at RBS Acupuncture. And I'm the nurse that does acupuncture in Ramat Beit Shemesh, Israel. Call me for any medical issues. I'll post my number later and my contact details. Today, I have a very special episode with a very special guest. This is a topic that I know nothing about. So I usually do a little presentation ahead of time so I can learn. But this time, I am going to have my presenter, my guest, do her own presentation, and we'll discuss what she does. She is a medical tattoo artist. Her name is India Abraham. And she is really talented, and she's going to let us know what she does with her presentation. So what is a medical tattoo? I'm very curious about this. I'm sure, we've all heard about people getting all kinds of tattoos and they're becoming much more popular through the years, but what is a medical tattoo? So just a little bit of research I've done. A medical tattoo is used to treat a condition, to communicate information, or mark a body location. And medical tattooing is an advanced form of cosmetic tattooing, and it can improve the aesthetics of a wide range of issues that had maybe just resulted in disfigurement and discoloration from surgery in particular, or even accidents. I'm sure she'll tell us, India will tell us everything. The goal of medical tattooing is to reconstruct perceived deformities through tattoo artistry so that our patients' inner beauty can be more visible to the world. One of a few of the things that you can do are the kinds of procedures that are listed are creation or modification of a nipple after maybe a breast mastectomy or areolar complex. You can create eyebrows, eyelash line, or restoration of hair loss on the scalp through microblading. One can have lip symmetry improved if you've had an operation or surgery on the lips and the face or accident. Improve the appearance of scars and correct hypopigmented lesions, usually from vitiligo, which is a disease of hair loss and body melatonin or melanin absence in the body. So the body can be a little bit like an albino, or also just the skin issue where there's all kinds of discolorations. There's a little history to this as well. A crude practice of corneal tattooing was performed by Galen. Galen was one of the first medical people we study about in medical school. Galen in 150 BC, okay? After AC, I guess you call it. He tried to cover up opacities where a lot of soldiers who were injured in wartime, and they were missing their eyes, so he would make a tattoo for them so that it looked like they looked a little bit more normal walking through the streets and they didn't have to be embarrassed. He used pomegranate bark and copper salt in the 1800s. During the Cold War, threats of nuclear warfare again created a lot of problems with disfigurement of soldiers in wartime. And so similar to dog tags, members of the U.S. military will have any kind of injuries covered up by tattoos, or they can have their vital information also tattooed on their bodies. Like they're called meat tags, which is terrible. But if they lose their dog tags around their neck, they have to have some way of identifying them. Of course, tattoos have also been used to provide notice to emergency personnel if a person has diabetes, or especially if they go in a diabetic coma, so if people know what to do for them immediately. Also, after radiation treatments, we can see that there's a lot of disfigurement and damage to the skin. Tattoos can correct for that in terms of putting something beautiful there to cover it up. You also can use tattoos to mark surgery itself and mark for radiation itself. And that's what we're going to talk about today. My special guest should be waiting to join us. Her name is India Abraham. Let me see if we can bring her on. Okay. Hello, India. Are you with me?
Hi. Thanks.
Okay, let me say a little bit about you. I was just saying a little bit about what medical tattooing is, and we're really curious to hear what you're going to discuss. India and I met on a women's business group, and she lives in Jerusalem, Israel. And I live in Beit Shemesh, Israel. So we haven't met in person yet, but we're going to be very good friends, I have a feeling. India Abraham is an accomplished individual and the head artist and founder of a business for medical tattooing called Feel Your Whole Self Medical Tattoo. It is a division of how do you say this? Lackluster beauty bar. Okay, lackluster beauty bar in Jerusalem. You'll tell us where later. She has a master's in science in public health and a bachelor's of science in biology. And she's been working tirelessly to address health disparities among individuals with diverse ethnicities and socioeconomic backgrounds through her involvement in various public health initiatives and protocols. But it was her discovery of medical tattooing that ignited her true purpose. So you'll tell us about how you came to this. Tattooing provides a perfect intersection of all her passions, her love for science and medicine, and her unwavering desire to help others. And her also includes her innate creativity. Notably, India is certified in one of the most unique forms of medical tattooing, known for yielding less trauma and achieving superior long-term healed results compared to its traditional counterparts. She's very dedicated, and she's trained with global experts all over the world, Israel, UK, Canada. She has honed her techniques in to meet the highest standards possible, and she relentlessly pursues excellence to lead her to collaborate with surgeons and healthcare professionals all across the country, and this would be Israel, I guess. And your commitment to your craft shows a passion for making a positive impact on this field. And innovative and compassionate approach she has. She continues to touch the lives of many people. So, India, without further ado, please welcome to Wellness Wednesdays with me, Yehudis. Thank you for joining me. I know you're a busy lady, and it's hard to get hold of you. You have children, and you make time for me. So I really appreciate that so much.
No, it's an honor to be here today. Thank you so much, Yehudis, for having me. Yes, like you said, we haven't met in person yet, but yes, friendship is there. It's there already. We're already girlfriends.
Great. Doesn't matter the age difference, right?
Doesn't matter. Age is
no, it doesn't. I don't think it does. Anyway, so tell us about yourself, India. Where are you from? And I know what your background is, but you said you got interested in medical tattooing, and I'd like to know. We'd all like to know what drove you to doing this as a career.
Okay. I am originally from Los Angeles, California. I made Aliyah to getting close to 3 years now. Ago. I live in Jerusalem with my 2 boys. I'm a mom and business owner. I knew that I had spent a lot of time just in the healthcare industry. So I worked in everywhere from like free clinics to research labs. I worked in hospitals and all these different things, and was really just so passionate. I did a lot of work for underserved populations and things like that. And so I always had this just passion for helping people. But one of the things I noticed, especially being in public health, was that it wasn't necessarily the diseases that you needed to look into and figure out how to treat. It was a whole person. When a person doesn't feel good about who they are, that impacts so many things. It impacts their physical health, their emotional health and well-being, the way that they look at themselves, the way that the world perceives them. And so I was always interested in, this. I had this other side of me that was really into beauty and creativity and everything. And so I was like, oh, I wish there was like a way to merge all the best parts of me into one thing. And then I had heard about cosmetic tattooing originally. And in order to be a medical tattoo artist, you have to first learn one of the more basic forms of tattooing, so lips or brows, because the other sides of tattooing, medical tattooing, are much more challenging. So I started learning brows and lips. But all the while I knew that unless it was something where, somebody had, some kind of trauma, I really liked the idea of restoring someone and helping them feel much more confident about themselves.
Did you train in Los Angeles first initially?
No, initially I didn't start tattooing until I moved to Israel. I originally in America, I was all about public health, all about sciences, and then I did the beauty thing on the side because I just it was hard to split myself in half, because I always felt like you grow up and you have this one track mind, but then you have these other parts of you, and you're young, so you're trying to figure out okay, do I jump one ship and do one thing, and how do I merge what all the things I love, and so I finally found that happy medium. with medical tattooing. And the thing I like about it is that I have a different perspective than a lot of artists, because I do have that medical and health background.
Yeah.
So I'm able to relate to people in a different way. So, I know what it's like to be present inside of, a surgical suite, and, watching doctors, stitch people up, and, helping the orderlies, clean up after surgery and all that kind of stuff. So I've been there, done that. I know what it's like to, deal with someone who's going through cancer, because I've seen that. I've done research in that type of thing. So it gives me just a different way of relating to people. And so I love what I do. And it's so amazing just how life-changing it can truly be for people. Because people think like medical tattooing, it's all about, I had to have been in, I don't know, some kind of horrific situation. But it's not about that. It's about any occurrence in your life that has caused you to have a scar, or have some kind of, disfigurement in some cases, like you've said, to help you feel more confident, to help you feel more like yourself, to help you feel more whole. And that's where the name came from, because I noticed that a lot of doctors, they would talk to me and be like, people don't feel whole, after like a mastectomy, for example. You're a woman, and you spend your whole, puberty and your whole adulthood with breasts, and then you have this horrific thing happen where you have to have this surgery to get it removed, and you don't feel whole. You don't feel like a woman. You don't feel feminine. And so if I could just play a small part in helping anyone feel more confident and more like themselves, more beautiful when they look in the mirror, then that is just such an honor.
Amazing. Listen, I want you to give your presentation, and also when you well, at the end, we'll give details on how to contact India. And I wanted to ask you, are you very busy like all the time? I mean, how are you busy all day, every day? Is this something occasional, or is this something that's really a full-time?
This is
That's amazing.
full-time. Running a business is like, it's a full-time job. Like I have like an admin, like maybe like half day or something where I can like, focus on things. So like sometimes like my social media, it's funny because it'll go like, I'll do really good for like 2 weeks where I'll like, okay, let me do it this way. Let me get all the posts done. And then it's like, when I'm like super duper busy because there's like no posts.
Okay, well, no, and I know that about you too, just by contacting you. I'm the same way, by the way. I sometimes takes a while to get back to people, and it's not that I don't care, just that, whatever's busy. So you're busy, and you're working in the area hospitals, or you're working in your own clinic, or?
So I have my own clinic. I do work with quite a few surgeons throughout Israel. I've partnered with hospitals, so like Hadassah, for example. I am on their resource list. So if you go to Hadassah and you have had cancer, you can go to them and say, hey, I'm in Jerusalem, or I'm in Tel Aviv. I want to think about getting something like this done. Who could I go to? They give you a list of resources, and I'm one of those for Hadassah. Shar Aesthetic, those ladies know me really well. And so in the breast health clinic, for example, you can go in there, and my pamphlets are there for more information, because people don't understand both men and women get breast cancer. And so this is an option for both, all genders, trans, non-binary, it doesn't matter. So it's a procedure that I do that's open to everyone.
Okay, let's start your presentation. I'll save my questions for the end, because
Okay.
I know you're probably going to answer a lot of my questions as you present. Okay, I'm going to try to share the screen like we did before.
Okay.
We practiced this, everybody. We really did.
We did. We were ready.
And my page knows I'm not a real high-tech person. Yeah, here we are. Okay, can you control this from your end then, or how does this work?
I can control it, so you're going to have to put it on. There should be a button on there that says present, so you can make it a little bit bigger for the audience if you want.
I see the screen underneath. I don't know how to change that.
Do you see the little, it's like a little slider that says like page 1 of 10? And then you can also hit the arrow.
I have to go back, but I have to go back there and do that. Okay. Yeah, but we want to see each other too. So let me go back to that. I can't. You like this?
Hit those little. Zoom out a little.
I changed it. I did it already, but it didn't seem to make a difference.
hit those two little arrows there. Do you see them? They're like,
Yeah.
it's like 4 boxes.
Let me go back. Go back. I have to go back onto the thing itself. It looks like, right?
They're not believing that we practice. There we go. Perfect.
That's what we wanted. Okay, thank you. Takes a younger person to help an older person with technology. We know that. Okay, go ahead.
So again, I'm India Ibrahim.
Speak up a little more because I think there might
Okay.
be something a little bit with your microphone for some reason. And I'm going to recommend to you to use an external one next time because the computer ones sometimes are just not adequate. But I can just if you
Okay.
wouldn't mind. Okay, thanks.
Okay, so again, I'm India Ibrahim. I am the founder of Fill Your Whole Self. We are located in the Talpiot area of Jerusalem. And so I'm here today to talk to you about how medical tattooing can impact your life and the lives of your loved ones. Okay, you can go to the next slide. Okay, so now we are going to talk about just what medical tattooing is. I kind of went into that in the introduction, and its role in building just self-confidence, art, and science and healing. So, what a medical tattoo is unlike a traditional tattoo where our focus is creating, I don't know, a unicorn on your arm. We go in and we use skin colored pigments and corrective color pigments. So sometimes I don't know if anyone's had like a scar, okay, on their hands, like a fresh scar. Sometimes scars will heal purple or pink, or sometimes even darker in color. So what we do is we can go in there and we use the tattoo ink. It's designed, this particular type of tattoo ink is designed for skin color corrections. And so we go in, we correct the coloring, and then we match it to your skin tone, depending on the issue. Some people have a very light white colored scar. That'll heal like really light. Like if you had, I don't know if there's any moms out there, like if you had a C-section, sometimes those will heal like when it's been a few years, they heal pretty white. So those we use your skin tone color. But if there's color correction that's needed, we do a second procedure. And so here in this presentation, there is a link. I had the honor of speaking with Dr. Joseph Haik. He is the chief of plastic surgery at Sheba Medical Center in Ramat Gan. And he did research a number of years ago on medical tattooing and how it can really change a person's self-image after surgery. So I talked to him, and according to him, years and years ago here in Israel, the surgeons would actually do the tattooing, but they don't do that anymore. And so now it's on us to do all the end of the work there. You can go to the next one. Okay, so who is medical tattooing for? Medical tattooing is for anyone, any age. Of course, if you're a minor, you need parental consent. But people that have had post-surgical, so if you've had, I don't know, anything from a tummy tuck to a knee surgery, you can get a medical tattoo done. Breast cancer survivors. So even if you've had a bilateral, which is where they remove both breasts, or unilateral, where they remove just one breast, you can get a 3D areola tattoo done. The method that we utilize is absolutely amazing, but we'll talk a little bit more about that. Burn victims, people with stretch marks, we offer a couple different procedures for that, and anyone with old scars. So some people, has anybody had this chicken pox? Okay, so I had the chicken pox as a kid, and I was left with quite a few chicken pox scars. Because your mom tells you like, don't scratch, and you scratch anyway. And so I was left with a few chicken pox scars, and I know a lot of people who have. And so we could camouflage, even though it's because they heal different than the surrounding skin. And for some people, like you might have it in the center of your forehead. I had a client like that. She was like, I don't like it. Can we fix it? And so for burn victims, I do want to do a side note. Burn victims tend to get what's called contractures in addition to just regular scarring. And so this type of scarring, it inhibits the mobility of the body. So this can happen like anywhere, like where there's a need for range of motion. So like the insides of the elbow, the fingers, anywhere. And so it makes it very, very difficult for a person to have mobility after they've been severely burned. And so this is something there where we go in with a tattoo needle. We have one session where we break up that tissue so that the body can start reproducing its collagen and elastin, similar to what we would do for stretch marks. Then you come back for a second treatment. And what we'll do is we will then color the scar to match your skin tone.
Wow.
So this is a multi-step process depending on the severity of your burns. And then we do what's called inkless stretch mark revision. It's a form of medical tattoo that uses no ink. So if you've had a tummy tuck, for example, a physician can remove all of the stretch marks from the belly button and below, okay? But they can't remove the stretch marks that are above the belly button. It's just not physically possible. So what they do is they send clients to me, and what we do is we utilize a serum. There's no ink in there. We utilize a serum to go in and help the body start reproducing its collagen and elastin. And you have anywhere from like a 60 to 90% improvement in just one session. So most clients only need one session. If you want to be, perfect as far as we can be, you can opt for 2 sessions. But most people are just amazed by one session results.
Incredible. I never thought the chicken pox thing, and I also stretch mark is a surprise to me that the stretch mark would. Of course, there's so many people that it's really unsightly. Not only just, but they think like you said, they don't feel good inside themselves, and maybe nobody else even cares. Or sometimes when people have lost a lot of weight or whatever, there's all kinds of reasons.
I mean, bodybuilders have stretch marks. You're done with puberty and you have stretch marks.
And
Moms
women who have triplets and things like that. I mean, it really happens.
Yeah, everybody gets stretch marks. It's so common.
Yeah. Should I go next?
You can go to the next one. Okay, so what are the benefits of medical tattooing? So with medical tattooing, we do what is called camouflage and color correction. So sometimes it's, like I said before, it's multi-session, depending on like the coloration of the scar. Like for example, this picture that's to the left here, this person, they have a scar on their arm. And as we can see, the border of that scar is quite dark, okay? And so what we would do is we would go and color correct that first with a color that is going to inhibit that, because that scar has a bit of like a brownish purplish hue when you really get up close and personal. And so we'll go in there and we'll color correct that. And then you see that other portion of the scar that's more like a bit lighter. So then we'll go in with a color that matches in that second session. So that first session is all about color correction. That second session is all about skin tone coloring. Okay, and so what my method does that's different than what most people are taught in medical tattooing is color correction is first and foremost. Because like nowadays, a lot of medical tattoo artists, they'll come in with just a skin tone color, they'll color over everything. And what I found was that if, for example, if I went in and I colored her skin with the color that matches her, all I would do to the surrounding tissue that's darker is make it darker. And it would still, when it heals, it would still look rather unsightly. And so it'll look a little bit better, but why be just a little bit better when you can be a whole lot better? And so that's why we add that element of color correction if necessary. Now, some people, they have just a white scar and we can just go in there and do what we do. And also just the method of pigment implantation that we do is also very, very different. We use a trademarked technique that most people worldwide don't know. And so I learned that in the UK. I trained with one of the top trainers just in the world for this. So that way we can make sure that we're very, very precise and very, very meticulous in how we do things. Another benefit of medical tattooing is just the physiological healing and the emotional healing. When you've gone through any sort of surgery, for instance, like if you get a facelift, okay, you may not want everyone to know that you got a facelift, and that's your choice, that's your prerogative, and that is okay. But you want to be able to wear your hair up. But when you get a facelift, you tend to have scars along the hairline and the back of the ear. And so because of that, you may feel self-conscious about wearing your hair up because then everybody goes, oh, he got a facelift, she got a facelift. And so
Yeah,
that's
who wants
not,
anybody to know that?
you don't want everybody to know that, but we
You just
just
want to look good for your age. You don't want to tell them how you did it.
you just and that's the thing. I think
Nobody's business.
what we have to understand is everybody right now is like, oh, you need to just embrace your beauty and embrace the way you are and blah blah blah. But that it doesn't mean just because you get a facelift, it doesn't mean you don't love yourself. It doesn't mean that you don't think you're beautiful. It doesn't mean any of those things. It means you want to feel better. And there's nothing wrong with wanting to feel better about the skin that you're in. I'm a big proponent of that. And so when you've had, different things, like I was explaining to someone, if your wife, for example, had, gone through an accident, would you tell her that she should just stay that way? If she woke up in the morning and she did not feel her best or feel like she was worth it, would you want her to continue to feel that way? If your husband, had to have knee surgery, and, those knee scars can be, they can be a lot. Would you want that person's confidence decreased by what they've gone through? And so with medical tattooing, I have the ability to really, really instill this feeling of wholeness, of confidence, and everything in a person. And that's really, really important to me. If I can help you leave out feeling better than the way you came in, I've done my job. I've done my job. Because it's all about restoring your self-confidence. When you look in the mirror, I want you to be like, wow, this is absolutely amazing. I feel so good. I just, wow, I look at myself. One of my first clients, I did a 3D areola on a cancer patient. She had breast cancer twice. And it was so, oh my gosh, the story was so difficult. She had told me, the second time she needed to have a mastectomy. And so they had removed her breast, she got reconstruction, but she couldn't look at herself in the mirror anymore. And it was, that's heartbreaking when you don't want to look at yourself because you feel like you're disfigured. And then when I did that tattoo, it's like the reactions are just, I don't know. I'm such a, and people that know me, they know I'm a crybaby. And I'm sitting there crying, like, oh my gosh, because she gets that moment where she looks in the mirror. And this is the first time you've looked in the mirror in so long. Like, and you love what you see. And so medical tattooing, it does so much for your health and your well-being on a mental and an emotional level. Right. The only thing that we can't do with medical tattooing is keloid scars. So if you have a keloid scar, we cannot tattoo over that because what happens is the keloid scar is an overgrowth of scar tissue, okay, and it keeps growing. So if we continue to traumatize it with tattooing, then it can continue to grow in some cases. So if you have a keloid, we do not tattoo over those. Now, a hypertrophic scar, it can in some cases look very similar to a keloid scar, but those can be tattooed over. Again, what we do is because it's a slightly thicker healed scar, so we go in and we help break up that tissue. Then you come in for your second session, which will be where we go ahead and do your skin tone matching. But hypertrophic scars are no problem for us. You can go to the next slide.
Yeah. I was going to write down a question.
Okay.
I want to get it at the end. Okay, go ahead. Okay.
Okay, so here I am showing you guys a little bit of the medical tattoo process. This is on a latex skin. This is a real person. And so the method that we utilize, um, it's almost like the way you would look at a photo. Have you ever zoomed in on a picture and you see like a bunch of teeny tiny pixels? Okay, think about it that way. So, what we do is by using this trademarked method, we cause less trauma to the skin, but maximum color retention. Okay, because a lot of times, medical tattoo artists that do a lot of shading and use a lot of a type of tattoo needle called a mag, for example, that heavy shading, it looks very nice in the beginning, very, very nice. But as it heals over time, like when we're getting to 1, 2 years out, it kind of comes together and it looks a bit murky. And so it doesn't keep its same look and its same structures when you first got it. And so a lot of times you'll notice a vast difference. Whereas the method that I utilize, we don't have that as an issue. Um, and so the way that we match your skin tone is I have so many tattoo pigments, okay, with so many undertones. For anybody that's into like makeup, for example, you may have, when you're trying to like match foundation, okay, y'all know how difficult that is. You've got the yellow tone, the pink tone, the olive tone. It's similar like this with tattooing. And so they make a million different colors of tattooing. And so we have color correction colors, which can vary from like yellows to greens to blues to purple. And then we have skin tone colors from for the lightest, most fairest of them all, like Snow White, to those gorgeous, brown goddesses. So we have something for everybody. And the thing about a medical tattoo, is that there's so many colors in the human skin. So we custom mix your undertone. We mix what color correction color you need. Everything is custom to you. There's not a one size fits all. Let me use yellow for everybody, because you can't. It's just not possible. Like I said, in some cases, it is a multi-session process depending on each case. So we have you come in for a consultation. That way we can kind of talk about what you need, what you've been through. You do have to make sure that in most cases, you need to be a minimum of 6 months out post-op, unless this is like an old scar. But if you've had surgery, you need to be a minimum of 6 months. And so what I will do is, if you haven't talked with your surgeon, like when you go to your checkup, if you know that this is something that you want, you can have them write me a note saying, you're cleared for medical tattooing, because we don't want to do anything too early. Or I can also speak with your surgeon and make sure that you're enough months out and that they feel like your body has healed enough in order for you to get the procedure done. And so touch-up time, go back one slide.
Sorry, I thought you
No, it's okay.
took a pause there. Okay, sorry, you didn't say touch-up yet.
So touch-up time, most people, if you get, say, the only time you usually will need a touch-up is if you get 3D areola work. And that's not for, in my case, I can't speak for other artists. In my case, and with the method that I utilize, you won't need a touch-up or anything for 3-4 years.
Okay.
Okay, now you can go.
Thanks.
Okay, so then this is the medical procedure known as inkless stretch mark revision. This is a no ink procedure, and we call it ISR. So ISR is for anyone who has had, like we talked about earlier, those contracture scars. So if you are a burn victim, we would utilize this method first for you, and then camouflage later. And then if you've had stretch marks, we'll utilize this as the method. And there is no ink in this. It's a serum that causes the body to reproduce its collagen and elastin. Because what happens when you have a stretch mark, for example, is the collagen and elastin, they rupture. And so that's why we have, those scars, because that's a form of a scar. And I don't know about you, but I don't particularly like mine. Some people do, and great for them, but that's not my favorite. So I'm glad that we have something that can be utilized. It's no ink, it's relative, minimal discomfort. You can get it done same day, there's no downtime, and it heals within 6 weeks, it's fully healed. And it's amazing because it does totally change that tone and texture. Now, this clip has a video here that you can press play in.
There's a video here?
Yeah.
Nope. It doesn't work from my end.
Okay.
Oh, listen, a testimonial, you mean?
Yeah, it's supposed to. You're supposed to.
No, it's not working for me. Sorry.
All right. No problem.
All right.
And so most people with this, they only need one session. Again, you get about anywhere from a 60 to 90% improvement on the stretch marks that you come in with. We can do this all over the body, anywhere except the face.
Okay.
Perfect. And so what makes us different from other artists? We are bloodborne pathogen certified.
Okay, just speak up a little bit more just because I really want to hear this. Maybe you go a little closer. Yeah.
Okay. Can you hear me better?
A little, yeah.
Okay. So what makes us different from other tattoo artists? We are bloodborne pathogen certified. We do the certification in the United States. It's the best certification. We make sure that we do this yearly. Israel doesn't have the same sort of certifications, but being American, and a public health master in public health, I'm very extra in that way. So I know about every infectious disease, and everything. So we not only want to protect our clients, but we also want to protect ourselves. So we do everything that we can to ensure a safe environment for everyone. From the way that we set up the room, because there's so many things that you have to do in order to just set up a room for a tattoo. And then we do have proper biohazardous waste disposal. I know that sounds silly, but a lot of people here don't, because it's very expensive. A lot of people here do not get proper biohazardous waste disposal. And the important thing about that is we want to protect the people that take out our trash. Okay? It's very, very important. We want to prevent needle sticks and all those different things. So we have a company that we pay 600 shekels every time they come pick up their trash to properly dispose of it for the safety of everyone and the safety of the environment. Like I said earlier, I'm a trained artist from just internationally recognized top artists. One of my instructors, she has a pigment line with one of the world's top lines. She has the method she teaches is trademarked. So I can't even teach it for 3 years. So it's very much under wraps. I've trained in the UK and Canada and Israel. And our method, it's designed to cause less trauma. And so you get that maximum color retention. So you don't need a touch up like most artists where you need to come back every year, every 2 years. We're 3 to 4 years with superior healed results. And so who do we work with? We work with locally here in Jerusalem. We work with Dr. Bianca Rosenberg. She is the founder of Astra Medical here in the Talpiot area. And then Dr. Gerben Yehuda, he's a plastic surgeon in Tel Aviv. We work with Shark Sedek and Hadassah. And then Salon Mary in Jerusalem. They're a lingerie store, but they get a lot of clients who've had mastectomies and things like that. So they send clients to us as well. So we've talked about today what medical tattooing is, who it's for, the benefits of medical tattooing, the process itself, the English stretch mark revision, what makes us different. Okay, and so lastly, we're going to talk about how to book a consultation. So if you know someone, say for instance, I don't know, you had a son, okay, with gynecomastia and he had the breast tissue removed and they leave scars. You can book a consultation for him. If you are a transgender or non-binary individual who's had top surgery, you could also book a consultation. Anyone can, like I said earlier, anyone can get scar medical tattooing and scar camouflage. We are open to everyone and any orientation. So you just give us a call. In the last slide, my phone number is there. You can DM us on Instagram if that's more convenient. You can email, whatever is more convenient for you. Does anybody have any questions?
There's your information. I'm going to also post it. Okay, this will be also, recorded, so people will be able to see this again, and I will post it on the chat. Not the chat because that's gets missed too easily, but I'll just put it with my post. But I just want to say thank you. It was such a beautiful presentation, so professional. I learned so much. I do have some questions, though, if that's okay.
That's perfectly
Okay, I'm
fine.
going to stop the screen. Let me get back to you for a minute. Okay, a whole lot of stuff will I go through. I've been a nurse anesthetist for over 35 years. So I also am one of these medical health professionals that comes from different perspectives. I wasn't always an earth mother, but now I've become one because over 10 years ago, I became a practitioner of Chinese medicine and acupuncture and, and nutrition and holistic nutrition and whatever. Also moving into cosmetics myself too, so we have a lot to talk about. But I did a whole spa evening last night where I did microneedling and things like that. Okay, because I'm trained, by the way, just so you know. Okay, anyway, do you need anesthesia for your procedures?
Okay, so what we do is we use most people, like if we're doing an English stretch mark revision, we don't use anything. There's no numbing for that. We do have a lidocaine spray if you're like super duper sensitive, but as of yet, I haven't had a client who's asked for it. The most you feel is like a light vibration, but not much else.
Let me ask you that. Please excuse my ignorance on this.
No,
I'm real anti-tattoo. I got to tell you, because especially in the Yehudis fight, we're not supposed to get. How does the regular tattoo parlors? What do they do? I mean, they inject ink, and their thing is painful, and they're not what one thing. They just also. I'm worried about their hygiene as well. I don't know if I would go into a parlor like that because I don't think they do. Obviously, they don't do what you do to protect for infection and microbes and all that stuff.
Now, so the only time we will use numbing is if we're doing, like, if I'm doing a 3D areola, or if I'm doing
3D?
if I'm doing anything with ink, then I will use numbing as a secondary option after I've broken the skin. Because when I first go over your skin, you don't feel much. And then if I'm going to be tattooing like a large area or something, you will have some discomfort. So we use a topical anesthetic and with a bit of epinephrine in it. It's a very small amount that we use, and so that you're not in any discomfort. It's the same thing that we would do if we did lips. Lips are very sensitive, for example, especially when we're doing like the color filling. And so we do use numbing for that. But if we're doing inkless stretch mark revision, no one has ever needed anything. Now, when you do go to a regular tattoo parlor, even if you go to a medical, I'm just being honest, even if you go to a regular medical tattoo artist, you need to know that they know their stuff. For example, okay, I'm going to give you an example. If you get lip blushing, okay, you are supposed to, as an artist, you are supposed to tell the client that they need to take antiviral medication prior to lip blushing, because unfortunately the herpes simplex 1 virus lives in majority of the population worldwide. Okay, and when we go in and we start breaking the skin, you can have a severe outbreak. Like some people go, oh well, I've never had it before, so I don't think I need anything. And it's no, as the artist, you are supposed to take charge and tell people that, hey, you may have had it as a child and may not have had another outbreak since, but it is always better to be safe than sorry, because if your client gets a herpes outbreak, they're not going to be happy with you. Okay? And so, I mean, yes, you can take medication and things like that to get over it, but why do that to someone if it's unnecessary? So, because again, it goes back to the knowledge that, like you said, like the knowledge that you have, the knowledge that I have, it goes back to being able to have a different understanding. Because I've had those horror stories where people are like, oh my God, I went to this girl and, she did my lips and, now I've got this horrible outbreak and I look a mess. And so it's what is going to be best for the person. When you get there, you have the right to say, hey, do you know anything about bloodborne pathogens? Because a lot of people don't. I know what Hep B, Hep C, HPV, and all those things are, but a lot of people don't. They're just not trained.
Right.
You want to make sure that they have proper disposal, that their space looks clean. It should be like my mom says, it should be like you could eat off the floor, type of thing. And so
When you go into a regular tattoo parlor, I've never been in one, but just I envision that they're not anything like this. I mean, they
some
don't
places
reuse needles.
are.
I know they don't do that, but are they really hygienic, these places?
Some people are. It just depends on the tattoo establishment. So if you go into one, if I were a client, I would go into one and I would ask them, hey, do you do biohazardous waste disposal? Are you guys trained in infectious diseases? Do you have an autoclave? Those are really important things. A lot of people just, they don't know what they don't know.
All right, let me ask you a question about, like, is this a very expensive procedure? And do you take insurance for this?
Okay, so the Mizrahi Habriut does help cover a portion, and in some cases, because I'm not the Kupa, so I can't speak to what they would do. In some cases, the Kupa can pay a portion. What that portion is up to them. The Mizrahi Habriut will also help pay a portion of the 3D tattoo service, okay? The 3D one for breast cancer patients. Now, the other medical tattooing, unfortunately, they consider this like any other cosmetic.
Yeah.
I am trying to work with the Kupas right now to figure out a way in which to help pay for these. But that's going to be a minute because that's never been done in this country, apparently.
Okay.
But for clients, for example, that fly from the United States, okay, or Canada, or any of those other places where we have, regular insurance companies, if you come to me, I can give you what's called a super bill, and you can take it to America, and they will pay a portion.
Oh, that's amazing. Okay, one last question, and I probably have a few more after we hang up, but I've been thinking about people who have abdominal scars and they have like contractures underneath, and it's hard to breathe and it's painful when they move and stuff like that. Does your procedure help loosen that up, and not just cosmetically? Does it help, like if I were to have I know people who have had people who have surgeries from like their neck, incision down from their neck down to their pubic area, and that it's so painful and healing later on, and they have multiple surgery revisions and stuff. Can you prevent that kind of thing?
I can't prevent it, but I can help loosen it. So if you have a contracture post-op, you can come to me, and that is one of those two-step processes where you can come to me and we can do the first procedure with similar to like what we do for our inkless method to help loosen it, help that body reproduce its collagen, so that because it's very, very painful, to help that body start reproducing its collagen and elastin again, so you can get that mobility back again and that flexibility back again in those tissues. And then we go in and we camouflage what's needed.
That's amazing. Well, this has been so enlightening, and you're so delightful, and it's really, I hope that people come calling you very instantaneously here. This is India's information on Instagram, and what I will do before we sign off is to also repeat the page with her phone number, stuff like that. But thank you for joining us. Maybe we can do that now. Can you see this? No. I have to share screen. India, thank you so much for taking your very precious time. I know you're a busy man.
Thank you for having me.
What's going on, and it was hard to even get you to. I am so grateful that I got you here, and I hope that people really learned a lot. And it's incredible what you do, and we were very grateful to have people like you in our midst to look at all the good you've done for the world and how much how much people are feeling so much better about themselves. And like you said, it's not just, it means so much to people. It's not even, it's nothing we can even, unless you go through it yourself, probably. It's probably
No.
nothing that we can even imagine unless we go through it ourselves, right?
No, it's definitely an honor. Like from people that do self-harm and all, it's such an honor to be able to work with people and make them feel good again.
And you're so qualified. I wouldn't go to anyone else. That's really true. Thank you so much for joining us. And I hope everybody just look at the details here. She's got a website in the process right now, and you can, there's a phone number there. It's an Israel number, but you can write to her. You have an email there too?
Yeah, so there's an email, cosmetictattoo@feelyourwholeself.com.
Oh, okay. There it is. And if anybody has questions, you can also reach me and I'll get you in touch with India. India, have a wonderful afternoon. And
Thank you.
really appreciate so much your time and efforts. And I hope to meet you very, very soon in person.
Wonderful. I can't wait.
Okay. Thank you so much, dear. Take care.
You too.
We'll
Bye.
see you next Wellness Wednesday will be in September.